Hi everyone, it's Dr. Simon. I want to go over your clinical choices case study. All of you should have received your grades by now. And I want to go over the movie case study for you as well so that you understand which components we'll be looking for. So I wanted to start off by telling each one of you how much I appreciate all the effort that you put forth in this assignment. Looking at the case study from the virtual counselor and creating your own write-up is something that is probably new for most of you. Overall, the grades were A's and B's, so I was very pleased with how you all were able to take the information from the counseling sessions that you viewed through the Launchpad and were able to write them up. There was a lot of really great use of counseling vocabulary, and I want to make sure that you look at the feedback that was given to you to help you prepare for your case study number 2. There were some areas that I saw common areas that we can improve in. One of those is to increase the use of the DSM-5 as our main source of diagnostic criteria. We want to remember that when we are working with clients, we don't use our textbooks to help guide us in how we're diagnosing. We use the DSM-5. The DSM-5 provides the diagnostic code that we would use if we were going to submit this to an insurance company or something that we are going to keep in the client's file. So if you did not use the DSM-5 or the DSM-5 diagnostic code when you were doing your case study, make sure that you do that for the movie case study. You should be able to use the DSM-5 as a way to look at the symptoms, the duration, and the criteria that's needed for you to come up with a correct diagnosis. You also want to make sure that you specifically identify cultural implications. There are some diagnoses that do specify whether this is something that's more traditionally seen within a certain age group, whether it's a childhood disorder or it's a disorder that you may see more in older adults, whether it affects women more than men or different things like that. So we want to go ahead and put those cultural implications. Cultural implications also help when we're trying to determine which interventions may be a more appropriate use with certain cultures. So we want to remember that as counselors, we have to be multiculturally competent. And part of illustrating what that is being able to identify different items that are part of someone's cultural identity. You also want to remember that you're speaking from the voice of a clinician. You are the clinician in these case studies. You are the counselor. You are using the information from the DSM to come up with a diagnosis. One of the things that actually was mentioned in quite a few of the case studies is that students said they didn't feel comfortable coming up with a diagnosis within the first visit. That is how counselors diagnose. A diagnosis is generally given within the first two sessions. One reason is because insurance companies are not going to pay if the client does not meet the criteria for the diagnosis that the insurance company is going to cover. So most of them do require that you provide a DSM-5 diagnosis with a DSM-5 code within the first or second visit. Some companies do allow you to use a unspecified diagnosis, but not many. Even if you're not using insurance and you're going to only take cash, you also want to remember that the clients want to know what they're coming to see you for. So you don't generally have many sessions to come up with this. Think about whichever theoretical orientation that you subscribe to that you would typically use when you're working for clients, and you could see that the theoretical orientation may say that this normally takes 12 sessions. So if you're going to use CBT, you may only use 12 sessions. If you only have 12 sessions, you have 12 sessions to come up with a diagnosis, to come up with goals, interventions, assess those interventions and see how the client is working towards those goals, possibly reestablish new goals and put those into place, and then you're also going to have to work towards terminating. If we're looking at that in those 12 sessions, you don't have 4 to 5 sessions or more to determine what the diagnosis is going to be. So typically, a clinician is going to diagnose within the first to second visit. We also want to make sure that you're following the required format. Whether you're working in a school or whether you're working as a private practitioner or if you're working in a clinic, Each one of those is going to have their own format to how you're going to complete a case study. Whether it's a case study that you're doing if you're working in a clinic, or if you're doing, as a school counselor, we did child studies. So if we were going to submit information to have the student recommended for special education services, we had to complete this child study, and we had to use the format that was required by the district. If you're working for a community agency, they're going to have a certain way that they want their case notes written. An insurance company is going to want a certain file in a certain format completed for you to file that so that they can pay for the services. If this format is not met, this could affect whether or not that child meets the criteria for special education services. It could affect whether or not the insurance company is going to pay, because they do deny services. So if you didn't fill out the paperwork correctly and have every I dotted and every T crossed, then your client could possibly not have their services covered and have to come out of pocket. There's no way for me to be able to teach you each one of those formats, because it's going to differ based upon district, based upon agency, based upon insurance company. So what we use to help structure that and help you learn how to work in a format is APA. So it is imperative that you follow APA. You have the APA checklist, and that lets you know which areas I'm specifically looking for, because I do understand that the AP manual is quite a thick manual. But there are certain components that I am looking for. So you want to make sure that you use the APA checklist and use it as a way to determine that you have included everything that you are supposed to. So you want to make sure that you have a correct title page. You want to make sure that you have level 1 headings. Use the APA sample paper to help you guide how you're going to format. You can also look at Purdue OWL and other resources. Make sure that you're using counseling related language. In a case study, you want to understand that this is something that the client can look at. This is something that could be subpoenaed, that could have to go to court. So leave your opinions out. Anything that you are putting in this case study, you should have something to back it up. Whether you're backing that up from the DSM, you're backing that up from research and literature that you found from a peer-reviewed journal, not information that you'll see like at Psych Central. That is not a peer-reviewed source. So use something academic. So use a journal. You can use a website. So if you go to and you're researching ADHD, if you go to the ADHD Foundation and there's a website that specifically is targeting that particular disorder, that's different than something that's Psych Central that people can type up an article and submit. That's a little more open to anybody giving their interpretation. So that's just some information based upon what was submitted. I want to go ahead and go through what you're going to do on your movie case study. So I'm on the movie case study page. And so this lets you know most of you have already done part 1 where you did your movie selection. The second part is the case study paper. In the case study paper, this is where you and your partner are going to collaborate and do what we call a client conceptualization. So what this means is the paper that you turn in, if I am working with my partner, our paper is going to look the same because we are working on the same client and we are observing the same behaviors. So you guys need to work together to come up with one document that you are going to submit. So what you can think about to help you with this is pretend that you all are part of someone's mental health team. So if my client is Jane Doe, so my partner and I are working with Jane Doe, who is our client, and we are coming up with the case notes for Jane Doe, and we are going to submit that to the insurance company so that they understand. So whoever is reading this case study has never met Jane Doe. So we have to be able to communicate information in a way that they understand who Jane Doe is, what her symptoms are, what her diagnosis is, and the type of treatment that we're going to provide. So when you're creating this case study, pretend like you're sending it to an insurance company, not to Dr. Simon. So here are the pieces that you're going to have to include. So we have part 2, the case study. Now each group member is going to have to submit their own paper but it should look the same. So me and my partner have the same paper, but we each submit it ourselves. That way, if I submit mine on time, but my some partner submits theirs late, you're not penalized because someone did something different. Your case study should include the background of the character, the possible causes of the disorder, the DSM-5 diagnosis. This includes the DSM-5 diagnostic code. Include the code, include the criteria that is used for the DSM to say that this is the diagnosis that the client has, include the duration. Some of the diagnoses will tell you that the client has to present with these symptoms for 6 months or 12 weeks or 4 weeks or on a more frequent basis. Whatever that particular diagnosis has for the duration, you need to include that because that is part of the diagnosis. If I have anxiety and my anxiety only lasts for 2 or 3 days, that does not necessarily mean that I should have a DSM diagnosis. So if I look at what the frequency is related to this anxiety and it says that these symptoms must present themselves for 6 months, that has to be included in the diagnosis. The insurance company is going to want to know how long was this there. If you're working for a school and you're looking at presenting this information before the department that looks at special education services, they're going to want to know, well, how long has this been going on? What have we done to ensure that we didn't have interventions that we can put in place before we label this child and we allow them to be part of the special education program? So a duration is something that is very important to also include that is part of your diagnosis. A discussion of all the symptoms of the displayed by the character. So you should have the symptoms that the character has, along with examples of where these symptoms have taken place, along with what the DSM-5 says. The DSM-5 may have 12 symptoms that they use to categorize under a certain diagnosis, but a client may only have to show 7 of those 12. So you need to tell me which 7 that the client shows and for how long. You also need to include if there are any psychopharmacology suggestions. If there are, explain those, explain why they're useful, explain what the research says. If there are none, explain why none are recommended. Some of the disorders are very specific that using medication is not going to help subdue any of the symptoms related to this disorder. So you should include that. If they're using drugs, why and which drugs are most commonly used for the disorder, or why not? Why is it that this particular disorder does not have medication recommended? How would you treat and create and implement a treatment plan according to your client's diagnosis? Include research to back that up. So if you're saying